Channel. This is Guntur Medical College Department of Anatomy, and you are seeing the dissected upper limb. We are seeing the course of the nerves in the dissection videos. In the last video we have seen the median nerve, and in this video we will see the course of the ulnar nerve. Are you seeing this is the painted nerve with yellow color is this ulnar nerve? Ulnar nerve is the branch of the medial cord of the brachial plexus, and its root value is C8 and T1. In this dissected limb, we are not seeing the axilla. We will see the relations of the ulnar nerve from the front of the arm. So this is the brachial artery along with the brachial veins, and this is the median nerve. Are you seeing this ulnar nerve is medial to the, it will be lying in between the, yes, it will be lying in between the axillary artery and the axillary vein. Then it will be medial to the brachial artery also. If you see in the front of the arm, in the middle of the front of the arm, it pierces the medial intermuscular septum. You are seeing nicely it pierces the intermuscular septum and it enters the back of the arm. In the back of the arm, it lies in front of the medial head of the triceps. Then it enters the front of the forearm by passing between the two heads of the flexor carpi ulnaris. Are you seeing this is the two heads of the flexor? This is one head and this is the another head. It is entering between the two heads of the flexor carpi ulnaris. Before it enters this between the two heads of the flexor carpi ulnaris, it is in relation to the medial epicondyle and to the olecranon process. You can nicely appreciate it is running in between the two bony prominences. This is the medial epicondyle and this is the olecranon process. It comes in between the two heads of the flexor carpi ulnaris and enters the front of the forearm. In the front of the forearm, it is accompanied by the ulnar artery laterally, and this is the flexor carpi ulnaris. In its remaining course, in the lower part of the front of the forearm, it is superficial. Then it passes superficial to the flexor retinaculum. So the flexor retinaculum is present here. It is disturbed in this specimen, but you can appreciate it is passing superficial to the flexor retinaculum along with this ulnar artery and enters the palm of the hand. In this palm of the hand, underneath the palmaris brevis muscle, which is the subcutaneous muscle which is removed here, it divides into superficial branch and deep branch. So that is the termination. The student should understand this is the termination. Underneath the palmaris brevis, it divides into superficial branch and deep branch. The superficial branch supplies the palmaris brevis muscle, and it also gives the cutaneous branches to the medial 1.5 digits. If you trace this deep branch dips in between this flexor digiti minimi and abductor digiti minimi, dips in between the two muscles, hypothenar muscle, and it pierces the opponent's digiti minimi and enters the palm of the deeper part of the palm of the hand. If you dissect here, it will be accompanying the deep palmar arch. In the concavity of the deep palmar arch, this deep branch will be ending. So this is how the termination of the deep branch of the ulnar nerve. If you see this ulnar nerve supply in the front of the forearm, you can nicely see it supplies the flexor carpi ulnaris muscle. So this is the branch to the flexor carpi ulnaris muscle, and it also supplies the medial half of the flexor digitorum profundus. So that is 1.5 muscles it supplies in the front of the forearm. If you see in this palm of the hand, except these three thenar muscles and first and second lumbricals, all the other muscles, intrinsic muscles of the hand are supplied by this deep branch of the ulnar nerve. We can count these three supply of this deep branch: 3 hypothenar muscles, third and fourth lumbricals, dorsal interosseae, palmar interosseae, and also the adductor pollicis. So this ulnar nerve is the nerve of the palm of the hand, and as it supplies the intrinsic muscles, it is called as the musician's nerve. So that's the how it supplies 1.5 muscles in the front of the forearm, but it is the major nerve for the palm of the hand. It does not give any branch in the front of the arm. I hope you should have understood this course and branches of the ulnar nerve in this video. With the radial nerve in the next dissection video, we will see. Thank you.